Giving you the inside track on local businesses. This is 13 Inside Track, sponsored by Franciscan Health.
Welcome to 13 Inside Track. I'm Laura Steele. Today we're coming to you from Franciscan Physicians Network, and it's Indiana Heart Physicians where we are today, and we are joined by just that. We are joined by cardiologist Dr. Atul Chugh, and we are here to talk about, what is American Heart Month. We're learning about heart health this month in February. Let's talk about hypertension. Usually it's associated with an older population, but no, we're seeing younger people who are affected by high blood pressure.
Absolutely. And we can talk about the usual sort of reasons why that is. We can talk about the increased salt intake in our lives, the fact that we're getting bigger. And so the obesity epidemic unfortunately rises the blood pressure at an earlier age. The fact that we have better screening process, right? There's a blood pressure cuff at almost every household now. But the one that we don't really focus on a lot is just what our lives look like today versus 30 or 40 years ago. The fact that we're bombarded by 3 or 4 devices at the same time. The fact that we're sleep deprived. This increases our internal catecholamine rates, which means that we have more adrenaline running through our bones, or through our system rather. As a result of that, what we see is a rise in blood pressure because that adrenaline has a direct effect on blood pressure.
We have to talk about treatment options because when someone does come to you, what do you know is the right avenue for them?
So the first thing we always start with is lifestyle, right? So the things that we can do: decrease your salt intake, try to do anything we can about weight reduction, which means that we decrease the caloric intake, the fact that we add some exercise, things that we could be doing. In terms of pharmaceutical or medications, we have over 160 medications. And a lot of that is just tailor-made based upon what you have in terms of background illnesses and, of course, what medications really suit you. Some folks just don't like some medications or they feel side effects, but the good news is we have a lot of treatment options. Unfortunately, about half of the population won't be able to take those medications for whatever reason after 2 years. So 50% of patients don't take the medications their doctors tell you. So I think it's a time for us to start thinking about non-pharmaceutical treatments. What we're really excited about is now a procedure that will be out very soon here at Franciscan that will allow us to do that, called renal denervation.
Okay, thank you so much. So knowledgeable on this very, very important issue and the things that we're all really affected by in our daily lives, and that is stress and all the things that really come at us in living our lives. So thank you for sharing all this important information. We've got information on the screen if someone would like to reach out to you and to find out more, and we thank you for your time today.
Thank you
so much. If you would like to see your business featured on 13 Inside Track, all you have to do is email us at 13insidetrack@wthr.com.
Today's 13 Inside Track was sponsored by Franciscan Health.